You ever look down at your hands and see something weird? A strange color, a little spot, maybe a new line on your nail? Well, it turns out our nails are kind of like tiny windows into our overall health. They're sending out signals that most of us don't even know how to read. So today, we're going to be nail detectives. We're going to learn how to decode those messages.
So yeah, let's just put it out there. What are your nails trying to tell you? That dark spot, is it just a bruise or is it something else? That little white speck, what's that all about? We're about to investigate some really fascinating cases that show exactly why it's so important to pay attention.
Okay, before we dive in, there's one word you absolutely have to know, because it's going to keep coming up. It's onycholysis. It sounds super technical, right? But all it means is that the nail has painlessly lifted up and separated from the skin underneath. See that little gap? That's where the trouble can start. It can be a symptom of something bigger or a place where other problems begin. So remember that word. It's our first big clue.
All right, on to our first mystery. Imagine you look down and see a dark, maybe even black discoloration on your nail. Your first thought, right, is probably, oh, I must have slammed it in a door. But what if you don't remember doing that? Let's dig into a case where this exact sign was actually a critical warning.
So let me tell you about this case. It's a 52-year-old woman and she's fighting breast cancer. Her first round of chemo went fine, but then her doctor switched her to a new drug called docetaxel, and that's when everything changed. After the second cycle, her nails started to get discolored, but by the third, it had exploded into severe pain, swelling, and yep, there it is, onycholysis. It got so bad she could barely do simple things, just daily life stuff.
And this photo, wow, it really shows you what she was dealing with. This is not a cosmetic problem. This is a severe, painful condition called nail toxicity, and it's a direct side effect of her treatment. Think about it. Imagine trying to button your shirt or just hold a cup of coffee when your fingers are in this much pain. It just shows how deeply these side effects can hit a patient's quality of life.
So what did the doctors do? Well, they didn't just throw one thing at it. They came at it from all angles. They used antibiotics, pain relievers, and simple things like warm saline soaks. And it worked. Just 3 days in, things were already getting much better, and by day 5, her pain was almost totally gone. And this is so important. Her medical team listened to her. They took this seriously, and they even adjusted her chemo dose.
Okay, case number 1 is solved. Now let's move on to some more colorful clues, and I mean that literally. We're talking green and blue nails. You might think they're kind of similar, but what they're pointing to could not be more different.
So on one hand, you've got a green nail. This is usually pretty straightforward. It's a local infection from a common bacteria called Pseudomonas that just loves damp places. But on the other hand, you have a blue nail. And let me tell you, this one is a whole different ballgame. It's often a sign of cyanosis, which means your blood isn't getting enough oxygen. That's not a local problem. It means something's going on with your entire body.
Let's zero in on this green nail syndrome. That greenish color you see? That's literally pigment being churned out by the bacteria. And guess where this bacteria loves to hang out? You got it, in that little space created by onycholysis, that nail separation we talked about right at the beginning. So if your nail lifts up and gets exposed to a lot of moisture, these little guys can just move right in.
Okay, now for blue nails, and I want to be really clear here. This is not something to ignore. This can be a major warning sign for some really serious stuff. We're talking about major heart and lung conditions like COPD, pneumonia, even a blood clot in your lung. Basically, when your body can't get oxygen-rich blood where it needs to go, your fingertips can be one of the first places to show it. It's a critical signal you have to take seriously.
All right, let's switch gears to something I'm betting almost every single one of you has seen on your own nails. Those little white spots. There is a huge myth about these, and frankly, it's time we put it to bed. So, be honest. What's the first thing that pops into your head when you see one? I'm willing to bet someone, somewhere, told you it means you're not getting enough calcium, right? That you gotta drink more milk. So, is there any truth to that?
Nope. Sorry to burst the bubble, but it's almost never a calcium deficiency. The real culprit, 99% of the time, you bumped it. That's it. A minor little trauma to the base of your nail, where it grows from, is all it takes to cause one of those spots. Now, other things can cause them, like an allergic reaction to nail polish or maybe a fungal infection, but it's usually just an injury. And yeah, only in really, really rare cases is it a mineral deficiency. And even then, it's more likely to be zinc, not calcium.
Okay, so we've looked at dark nails, green and blue nails, and white spots. We've seen how they can be clues for everything from a serious drug side effect to a major problem with your lungs to just, well, bumping your finger. So let's put all these pieces together and figure out what we're supposed to do with all this information.
Let's just circle back to that first case study for a second, because the lesson there is huge. The researchers behind it talk about patient-centered care. For that woman, her nails weren't some minor side effect, they were destroying her quality of life. It's such a powerful reminder that good medicine isn't just about fighting the main disease, it's about treating the person.
Okay, so what does this all mean for you? If you see something weird on your nails, what should you actually do? 4 simple steps. First, just look. Notice the change, but don't panic. Second, document it. Just snap a quick picture with your phone so you can see if it changes over time. Third, and this is a big one, do not go down the internet rabbit hole and start self-diagnosing. And please don't try crazy home remedies. And finally, the most important step of all, go see a professional. Talk to your doctor. They can tell you what's really going on.
When you get right down to it, our nails are just one of the countless ways our bodies try to talk to us. Your body is talking to you all day, every day, sending signals about what's happening on the inside. The real question is, are you listening?